Hey, Evelyn. So, I've been feeling really off lately.
Yeah, me too. Like weird symptoms and stuff.
It's been a few weeks since, you know.
Oh no, you don't think...
Okay, let's just check online, see if we can find anything.
Yeah, maybe it's just a coincidence, right? Hey, check this out. It's a post from an Instagram account about syphilis.
Rash, sores, oh no.
That's exactly what we've been experiencing.
Syphilis. How did we let this happen?
Hold up. What is syphilis? Syphilis is a sexually transmitted infection caused by the bacterium Treponema pallidum. Syphilis sores, which is one of the symptoms of primary stage of syphilis, usually start to show up around 21 days, 3 weeks after you've been infected. However, they can show up anywhere from 10 days to 3 months after you've been infected. Infection develops in stages primary, secondary, latent, and tertiary, and the symptoms vary with each stage. Now, here's something important to remember: you're not alone. In Malaysia, syphilis has seen a concerning resurgence among adolescents aged under 21 years in recent years. So if you find yourself facing this situation, know that seeking help is a crucial step, and there's support available.
Okay, let's not jump to conclusions, but we need to see a doctor and get tested.
So that's Evelyn. I've carefully reviewed your symptoms, and I'm concerned that syphilis might be at play. To confirm, we need to conduct blood tests to detect specific antibodies. Additionally, considering the severity, we may need a spinal puncture to collect cerebrospinal fluid.
Blood tests and a spinal puncture.
Yes, Hudson. Blood tests will help us confirm the presence of antibodies, crucial for determining if it's a current or past infection. The spinal puncture, though invasive, is necessary for a more accurate diagnosis, especially given the potential impact on the nervous system.
What does that mean for us?
First and foremost, it's essential for us to get an accurate diagnosis to tailor the treatment plan. Syphilis is a complex infection, and these diagnostic procedures will provide a clearer picture. If the test confirms syphilis, we have treatment options.
What are the treatment options?
The good news is that syphilis is curable with the right antibiotics for the early stages, including primary, secondary, or early latent syphilis. A single injection of long-acting benzathine penicillin G is effective. This treatment can cure the infection and prevent further damage, although it won't reverse any harm already done.
So there's hope.
Absolutely. But it's crucial to start treatment promptly. Syphilis can have serious consequences if left untreated, especially as it progresses to later stages.
We'll do whatever it takes, Doctor.
That's the spirit. Let's get these tests done as soon as possible, and we'll proceed with the necessary steps based on the results. Hudson, Evelyn, I appreciate your patience. The blood tests have confirmed the presence of antibodies indicating an active syphilis infection. The severity requires immediate action.
What's the next step, Doctor?
If we're going to start treatment right away, I'm prescribing a single injection of long-acting benzathine penicillin G. This antibiotic is effective against the syphilis-causing bacteria.
Will this cure us?
Now, if your treatment is potent, especially in the early stages, it will cure the infection and prevent further damage. However, it's important to note that it might not reverse any harm already done.
We're ready, Doctor. When can we start?
I appreciate your commitment. I've arranged for you to receive the injection at the clinic today. After that, I'll prescribe a course of antibiotics to be taken as directed.
This may sting a bit, but it's a crucial step in your recovery.
We understand. Evelyn, I think I can't do it. I do not want to take the antibiotics. It's too embarrassing.
I know how you feel, Hudson. I feel the same way.
Excuse me, you two. I couldn't help but overhear your conversation. Syphilis is a serious condition, and refusing treatment is not the solution.
Who are you?
We didn't mean to disturb anyone.
I'm a nurse, and I'm genuinely concerned about your well-being. Syphilis can have severe consequences if left untreated. It can lead to heart problems, paralysis, and even death.
I understand, but it's just so embarrassing to go to the clinic and pick up the antibiotics.
Yes, it feels like everyone is going to judge us.
I can understand that it might be uncomfortable, but your health should always come first. People at the clinic have a professional obligation to respect your privacy and confidentiality.
I guess you're right. It's just hard to get over the shame.
I just want to protect my dignity.
I understand it's not easy, but remember, you're not alone in this. Many people have faced similar situations, and seeking treatment is a responsible and courageous step.
You're right. We need to take care of ourselves.
Let's go to the clinic together, Hudson. We can support each other.
That's a wise decision. You're taking control of your health. And that's something to be proud of. Don't let shame hold you back from getting better.
Thank you, nurse. We appreciate your concern and advice.
We'll go get the antibiotics right away.
I'm glad to hear that. Remember, your health matters more than anything else. Take care of yourselves.
Hey folks, we're just back from the hospital, and let me tell you, we've had quite a ride.
Yeah, we really learned the hard way about how important prevention is.
So, what happened that made you realize this stuff?
And I'm Ruby. I was on the other side of that one-night stand with Hudson.
Yeah, we had a one-night stand. And I thought I was in the clear after getting treated, but well, Ruby and I didn't use protection, and I got transmitted with syphilis again.
And that's when we understood that prevention isn't just a one-time thing. It's a lifelong commitment.
I couldn't agree more. It was a wake-up call for all of us. We thought we were invincible, but we were wrong.
We're here to make sure you don't make the same mistakes. Let's talk about how you can prevent this from happening to you.
The only way to completely avoid sexually transmitted disease is to not have vaginal, anal, or oral sex. But if you're sexually active, you can take some steps to lower your risk of getting syphilis.
And second, using condoms every time you have sex. Condoms are great at preventing the spread of syphilis by preventing contact with a sore. Just remember that sometimes sores occur in areas not covered by a condom, so it's essential to be aware of your partner's health.
Let's make sure we take this step seriously. Prevention is our responsibility.
Can I catch syphilis again if I've been treated for it previously?
Having syphilis once does not protect you from getting it again. Even after successful treatment, you can get syphilis again.
Is syphilis 100% curable?
Yes. Your healthcare provider can treat syphilis with antibiotics. Antibiotics will cure the infection, but there's no way to repair organs damaged by syphilis.
What is the test for syphilis?
The test for syphilis is a blood test or spinal puncture for more accurate diagnosis. Kindly find a medical doctor for diagnosis and treatment.
Thank you for sharing these important prevention methods. It's vital information.
That's what we're here for. We've got your backs, and together we can kick those myths to the curb and take charge of our health.